This is my youngest daughter, Angie. She's 8. If some horrific trauma should befall her and she ends up in hemorrhagic shock, she, cover your ears, is fucked. And the reason is because for years, pediatric trauma references have been advocating for this 20 ml per kilo bolus of isotonic crystalloid for shock and hypotension related to trauma. And to not go right to blood products. Isn't that messed up? And the reason is they say blood products cause more coagulopathy in kids, and this leads to much higher rates of mortality. There's an emerging school of thought that this whole no blood for kids thing is dogma and probably not accurate. You can dive into why you wouldn't want to give blood products to a kid in hemorrhagic shock, but you're not going to find a whole lot other than these broad statements about increased mortality and more coagulopathy, like mentioned in this paper by Neff et al. They go on to say that there's not much high quality evidence out there on this topic. In 2022, Rapucci et al. Published in the Journal of Pediatric Surgery that injured kids can and do tolerate blood transfusion, even in massive quantities. In fact, in their particular study of 633 pediatric trauma patients receiving massive transfusion, they found no upper limit in how much infused volume is associated with more mortality. Yeah, mortality was overall high at 21.6%, but remember, these are critically injured kids who required an emergent massive transfusion. Perhaps it's the fact that kids who require blood transfusion after trauma are quite critically injured, and perhaps that's why giving blood is associated with higher mortality. I'm not a pathologist, and I'm not an epidemiologist, but I'd bet that that 21.6% mortality would be a hell of a lot higher if they withheld blood and just gave 20 ml per kilo boluses of crystalloid, because that's what PAL says to do. And in 2023, Perea et al. Published a study in the American Journal of Surgery, 90 trauma patients comprising ages 0 to 17 with both blunt and penetrating mechanisms. Whole blood was indeed found to be quite safe to administer to these injured kiddos. And yes, whole blood is best. Everyone loves whole blood. I love whole blood, but component therapy is okay too for kids. And while whole blood got all the love in the title and in the abstract, reading into the weeds of the paper, they did find a definite benefit with component therapy as well, and that there was no difference in mortality or complications between the whole blood group or the component therapy group. So blood for kids, it's okay.